Shawn, it is so nice to see you. Thank you so much for joining me today to just share a little bit more about what you and your colleagues in the Center for Telehealth at MUSC are currently doing and how you're planning for the future.
Absolutely. It's good. It's good to talk with you, Kingsley.
So what you, Dr. McGillicuddy, Dr. King, Dr. Ford, and the entire MUSC telehealth team have been able to accomplish is extremely impressive. Can you tell us what key factors enabled you to build a program like this?
Yeah, no, well, one, thank you for that. I think at the core of, like you mentioned, Dr. McGillicuddy, Dr. Ford, Dr. King, many others on our team, at the core of it is an origin around, a passion for our patients. And, that passion to be able to deliver care in a more, meaningful way that could not be done under traditional methods. So that's really at the core of, our center. Our mission statement is telehealth for efficient, effective care. So we're always looking to figure out how we can, do things in a more efficient, effective way. But from that, developing telehealth services, I would say there's a additional layer of perfecting our process. And one of the things that's helped catalyze our work is something we call TSIM, Telehealth Service Implementation Model. And so really what that means is having a phased approach, a guiding framework on how to create telehealth services. So, one, making sure that you have a clear, defined scope, a strategy of the service and what problem you're trying to solve. Very project management oriented. And then when you get into that development phase of navigating all the complexities of telehealth, when you're thinking about electronic health records, billing compliance rules, legal, all those different elements, the technology, and then once that's then built, the service is built, going into some smooth implementation and into normal operations. So by continuing perfecting our process, it allows us to not only create telehealth services that are efficient and effective, but having a process to be able to do that and create services at scale that meet the needs of our community.
That's great. I think having that structure around it really enables you to build upon what you currently have and then grow to meet, to your point, meet the growing needs of the community. So don't want to ignore the elephant in the room. I know that while COVID has been just a very challenging and horrible pandemic that we are still experiencing and addressing today, we've seen it instigate rapid telehealth transformation. How has your team at MUSC leveraged this opportunity to really grow and innovate?
Yeah, it's a good question. It's something right now in South Carolina is, I don't know if it's the second wave or really maybe our first wave of really hitting us right now. It's extremely challenging for a lot of the teams in our communities. But it is an opportunity for telehealth and even other industries. I saw Mark Cuban on TV this past month, and he really talked about, it's in these times when the market is disrupted that you should be looking at innovative ways to, reach your clients. And for us, it's reaching our patients and thinking of innovative ways to deliver the care, during these times. And we've always been doing telehealth services to hospitals and schools and different things like that. But where we've really had some great success with COVID was standing up ambulatory telehealth. There in South Carolina, we really didn't have any type of payment system for ambulatory care, so we didn't have a full-fledged strategy on that. We had some processes in place to be able to do things. Physicians did some things under grants and things like that. But we really had to stand up and flip our ambulatory efforts completely virtual. And this is an efforts of a lot of different folks, information solutions, ambulatory care, a lot of the physician champions stepping up, and the teams have had significant success. There's actually some good work being done by the Commonwealth Fund. They've been putting out a lot of different papers on this, and one of the things they showed was nationally at the peak on average, health systems were able to get up to 14% of their baseline ambulatory visits virtual. And MUSC was actually able to get up to 44%, so more than triple that national average. Now, of course, we had the infrastructure and the processes to be able to pull that out, in a rather fast motion. And that's some of the things that a lot of other institutions are going to need, that type of process, and physician leaders to really be able to step up and engage their team, knowing that it's not going to be easy. There's a lot of change management that goes on with that. but having those physician leaders to be able to liaison with their departments, divisions, back and forth, identify the problems, work with us to find some reasonable solutions, and then put them in place in a rapid manner. It's worked well for MUSC, and I look forward to see what happens, from here.
Yeah, I think it really is a time where people are open to that change, so might as well embrace that and move forward with it.
Yeah, absolutely.
So one last question, as others continue to invest in telehealth, or maybe they're just starting on this journey for their institution, what best practices or lessons learned would you share with them?
Yeah, a couple things I would probably say is one of our mottos in the center is think technology last. I often hear sometimes people will come to me and say, hey, we got this cool opportunity with this new gadget of some sort. Like, let's do something with this. And it's like, well, what's our strategy? What clinical service are we trying to apply this to? What problem are we trying to solve? And then when those questions can't be answered, that's a problem. You're already setting yourself up for failure. So really think technology last. Think about what are the challenges of your health system in general, and not even think about telehealth, but then think of those challenges. Is your challenges around access? Is it around patient experience? Is it around readmission issues or coverage or whatever it may be? You'll likely find a telehealth use case that's been done successfully that then you can learn from and figure out how that may impact your organization. And then the second thing I would say is, going back to our Center for Telehealth's mission statement of telehealth for efficient, effective care. Dr. Jimmy McGilligan ingrained in me early about, some people who've been in telehealth for like 20 plus years speak at conferences and say, telehealth's all about replicating care over distance. And I mean, I have a problem with that because we know the system is broken. And if we just use this technology to replicate a broken system, we're completely failing everyone who's investing their time and money in what we're doing. So how can we use the technology to, knowing that we've got patients with more chronic conditions as the baby boomers get up in age, know that we have provider shortages, know that we have increased healthcare spending across our country. How do we use the technology to create more efficient, effective care and really redesign the way that we're delivering care to our patients?
I think those are two great points, and I'm sure that many organizations can learn from what you and your team has been able to do at MUSC Center for Telehealth, taking those nuggets and applying them to their own organization, because we know that there's not one model that fits all, but there can definitely be some lessons learned from others. So thank you so much for your time today, Shawn. I'm sure that we will catch up in the coming weeks to see how all the work that is coming out of COVID has progressed at MUSC, and maybe some other new platforms that you're exploring as we get through this period of COVID and beyond. So thank you so much today for your time.
All right. Thanks. Bye.
Thank you.